the common medicine that's poison for your circulation and destroys your nerves. You might be taking something right now that's making you weaker, slower, and causing pains no one can explain. Maybe your blood pressure is under control, or maybe your cholesterol is at the right levels. But what's happening inside your body tells a very different story. A story of silent destruction. Weird symptoms start to appear. Numbness, tingling, leg pains, loss of feeling. And you think, it must be age, but what if it's not? What if the real culprit is something you thought was helping you? In this video, you'll find out why so many people have been suffering from serious circulation and nerve problems, even while following prescribed treatments and normal habits. And the scariest part, it might be happening to you too, without you noticing. Watch until the end and understand what's behind these mysterious symptoms. The answer could change the course of your health. Number 9. Chemotherapy drugs. Chemotherapy drugs like paclitaxel and vincristine are essential medicines in treating various cancers, but their side effects can be devastating. They're highly toxic to the peripheral nervous system, causing a condition known as chemotherapy-induced peripheral neuropathy. This type of nerve damage compromises the proper transmission of signals between the brain and the rest of the body. The patient might start feeling subtle changes, like tingling or burning in the hands and feet. Over time, these symptoms can worsen into disabling conditions. The impact on blood circulation is another critical effect. Nerve injury affects the body's control over blood vessels, impairing blood flow to the extremities. This results in constantly cold hands and feet, pale skin, and persistent numbness. In many cases, the patient loses sensitivity to heat, cold, or even pain. Unfortunately, these damages can become irreversible even after stopping treatment. The risk of wounds on the extremities also increases due to poor tissue irrigation. Motor nerves responsible for movements are also affected. Muscle weakness, difficulty walking, and loss of balance are common for those undergoing treatment with these substances. Imagine struggling to hold simple objects or climb stairs. This not only affects quality of life, but also raises the risk of falls, especially for older people. With each chemotherapy session, there's a chance the neurological condition worsens. That's why constant monitoring of neurological symptoms is essential. It's important to highlight that the risk is not limited to a single class of chemotherapy drugs. Several medications used in oncology have this same toxic profile for nerves. What varies is the aggressiveness and how quickly symptoms appear. Some patients notice the first signs of neuropathy after just a few doses. Others only start noticing effects when damage is already advanced. That's why any strange symptom must be reported to the doctor immediately. Besides the effects on nerves, these medications also affect the vascular system, damaging the health of blood vessels. Small arteries and veins can suffer from inflammation and spasms, making circulation even harder. The body struggles to properly nourish peripheral tissues, adding to nerve suffering. This combination, nerve injury and poor circulation, is extremely dangerous and can lead to serious complications. In some cases, even the patient's mobility can be compromised. Number 8. SSRI antidepressants. Selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, are widely prescribed to treat depression and anxiety, but their effects on nerves and circulation often go unnoticed. These drugs act directly on the central nervous system, regulating mood through serotonin. However, they can alter conduction in peripheral nerves, causing symptoms like numbness, tingling, and even electric shock sensations in the extremities. These symptoms can appear subtly and increase progressively with continuous use. Besides sensory changes, SSRIs can also impair peripheral circulation. This happens because serotonin, although essential for emotional balance, also regulates vascular function. By interfering with this substance, these antidepressants can cause vasoconstriction in certain parts of the body, making blood flow difficult, especially in the extremities. As a result, patients may experience cold hands and feet, cyanosis, and a greater tendency for wounds that heal poorly. All this can seriously affect comfort and mobility. One of the biggest risks is underestimating these symptoms. Many patients and even health professionals don't connect antidepressants with neuropathy. So, side effects are often attributed to other causes, delaying diagnosis and proper treatment. This lack of recognition can worsen the problem, leading to persistent neuropathy. The longer the nerve is attacked, the greater the chance of irreversible damage. The ideal is to always be alert to early signs and adjust medication if necessary. The elderly deserve special attention here. With aging, nerves become more vulnerable to chemical and physical assaults. The use of SSRIs in people over 60 must be closely monitored, especially if there's a history of circulatory problems or foot sensitivity. Combining with other medications can increase negative effects. Medical vigilance and open dialogue between patient and professional are key to preventing complications. Despite the risks, it's important to remember SSRIs are essential for the mental health of millions. The secret is conscious, well-guided use with constant monitoring. Dose adjustments, plan breaks, and periodic neurological and vascular evaluations significantly reduce negative impacts. Never stop using on your own. Sudden withdrawal can cause intense side effects. Always talk to your doctor before any change. Number 7. Corticosteroids. Corticosteroids, like prednisone, are widely used to treat inflammation, allergies, and autoimmune diseases, but long-term use can bring serious consequences for circulation and nerves. One of the main problems is fluid retention, which causes swelling in limbs and increased pressure inside blood vessels. This compromises efficient blood flow and can cause pain, a feeling of heaviness, and even tingling in extremities. Poor circulation makes nerves more vulnerable to injuries. Another common effect of corticosteroids is high blood pressure, representing a double risk: overload of vessels and nerve tissue damage. Blood vessels work under more tension, harming their natural elasticity and facilitating micro-injuries. Over time, this can cause changes in nerve conduction and impair tissue oxygenation. Nerves need proper nutrition to function correctly. Without it, symptoms like numbness and burning arise. Continuous corticosteroid use is also linked to blood vessel wear, making them more fragile and prone to ruptures. This circulatory fragility harms nutrient delivery and toxin removal from tissues. The result is inefficient circulation and a setting favorable to nerve suffering. Also, increased blood viscosity, common with these medications, worsens the problem. It's a vicious cycle that needs breaking. It's important to highlight corticosteroids don't just affect the vascular system, but also directly impact nerve metabolism. They interfere with nerve fiber regeneration and repair, making lesion recovery harder. For people already suffering neuropathy, these drugs can speed up condition progression. Even healthy individuals using high doses continuously can develop insidious peripheral neuropathies. That's why medical monitoring is indispensable. Although extremely effective for pain and inflammation control, corticosteroid use should always be as short and controlled as possible. Therapeutic alternatives may complement or replace treatment in some cases. Strategies like anti-inflammatory diet, moderate exercise, and physical therapy can reduce the need for these drugs. The goal is to protect patients not only from the problem motivating corticosteroid use, but also from severe side effects. Number 6. Proton pump inhibitors. Proton pump inhibitors, PPIs, like omeprazole and pantoprazole, are commonly used to treat acid reflux and gastritis. However, long-term use of these drugs can cause dangerous side effects, especially for nerves and circulation. The main problem is reduced absorption of vitamin B12 and magnesium, two nutrients fundamental for neurological health. Without them, the risk of neuropathy increases significantly. Vitamin B12 deficiency causes degeneration of the myelin sheath, a structure that protects nerves and ensures proper nerve impulse transmission. When this protection is compromised, symptoms like numbness, tingling, and loss of sensitivity appear, especially in hands and feet. Magnesium deficiency directly affects nerve electrical conduction and muscle relaxation. These deficiencies can install silently, worsening over months. Besides nerve damage, poor magnesium absorption also impacts the circulatory system. Magnesium is essential for blood pressure control and proper blood vessel contraction. Without it, vessels tend to become stiffer and less responsive, making circulation inefficient. This results in symptoms like tired legs, frequent cramps, and even high blood pressure. Poor circulation can develop without the patient linking it to the medication. Another worrying point is many patients take omeprazole for years without guidance or reassessment. This turns a useful medicine into a silent bomb for nerves and vessels. Long-term use is also linked to higher fracture risk, indicating generalized mineral imbalance in the body. This imbalance affects the nervous system and compromises vascular integrity. The whole body suffers from lack of basic nutrients. Can you continue treatment with proton pump inhibitors safely? Yes, but only with medical monitoring and proper supplementation. Regular vitamin B12 and magnesium tests should be part of the routine for long-term users. In many cases, diet adjustment or multivitamins can prevent irreversible damage. Never extend use without control. Each extra month increases risks. Number 5. Fluoroquinolones. Fluoroquinolones, like ciprofloxacin, are powerful antibiotics used to treat urinary, respiratory, and gastrointestinal infections. However, what many don't know is their devastating potential on peripheral nerves. These drugs can cause a condition called antibiotic-induced peripheral neuropathy, which manifests as tingling, burning pain, and muscle weakness. Alarmingly, damage can be permanent even after just a few days of use. One of the most affected targets of fluoroquinolones are tendons and nerves, making physical symptoms even worse. Cases of tendon rupture and intense muscle pain in healthy people with no previous problems have been reported. This happens because these antibiotics interfere with cellular metabolism and connective and neural tissue integrity. As a result, patients feel persistent pain and motor disabilities. These symptoms aren't rare, just underestimated. Another concerning point is the extremely short latency time. While other neuropathies develop over months, fluoroquinolone-induced neuropathy can appear in days. The medication directly affects mitochondria of nerve cells, making energy production harder and speeding degeneration. This makes the peripheral nervous system highly vulnerable. Once damaged, nerves rarely fully regenerate. Besides neurological damage, there are also effects on peripheral circulation. Vascular function can be compromised, leading to poor blood flow to extremities and increased risk of necrosis in severe cases. People feel cold feet and hands with constant needle pricks. The combination of muscle weakness and poor circulation creates a worrying scenario for mobility and quality of life. Patient autonomy can be seriously affected. It's crucial to remember these antibiotics shouldn't be used without prescription and real necessity. Other antibiotic classes with lower neurological risk may be effective alternatives. Medication choice must consider each patient's history, especially those predisposed to neuropathies or circulatory problems. Prevention is always the best medicine, even with antibiotics. Number 4. Thiazide diuretics. Thiazide diuretics, like hydrochlorothiazide, are widely prescribed for blood pressure control. They work by eliminating excess body fluid, reducing circulating volume, and therefore pressure. However, this benefit comes with a considerable risk: loss of essential minerals like potassium and magnesium. These minerals are fundamental for proper nervous and muscular system function. When eliminated excessively, the body suffers a lot. Potassium deficiency, known as hypokalemia, causes cramps, muscle weakness, and cardiac arrhythmias. Magnesium deficiency directly affects peripheral nerves, causing tingling, burning sensation, and fatigue. What starts as mild discomfort can progress to severe neuropathy. Many patients associate symptoms with age or inactivity when the real problem is the medication that was supposed to help them. Another critical point is the reduction of these minerals impairs muscle contraction and vascular regulation, two key factors for efficient circulation. Lack of magnesium compromises vessel dilation, raising blood pressure and hindering blood flow to limbs. This overloads both the heart and nerves. As a result, hands and feet may feel cold, numb, and even lose strength. Elderly patients and people with chronic diseases are particularly vulnerable to these effects. Prolonged diuretic use without lab monitoring can lead to severe electrolyte imbalances. These imbalances affect not only the cardiovascular system but also nerve function, interfering with the electrical impulses controlling everything from movement to sensation. Reflexes become impaired and fall risk increases. Fortunately, these effects can be prevented with proper monitoring. Potassium and magnesium replacement is common in patients using diuretics continuously. The key is to do periodic tests and adjust medication based on results. Never ignore symptoms like muscle fatigue, irregular heartbeats, or persistent tingling. They may be early warning signs of a bigger problem. Number 3. Metronidazole. Metronidazole is an antibiotic widely used to treat intestinal, vaginal, and parasitic infections. Despite its effectiveness, this medicine hides a serious and little discussed risk: peripheral neuropathy induced by prolonged use. This means that if used for long periods or repeated doses, metronidazole can damage nerves in the body's extremities, especially feet and hands. The result is progressive loss of sensitivity, accompanied by pain and numbness. The way metronidazole affects nerves is related to mitochondrial dysfunction, which compromises energy production in nerve cells. Without adequate energy, nerves fail in their basic function, transmitting electrical signals precisely. This leads to symptoms like shocks, burning, loss of touch, and balance problems while walking. Over time, patients can even lose perception of temperature or pain in their feet, increasing injury risk. This risk is higher when patients already have predisposing factors like diabetes, poor circulation, or B vitamin deficiency. In these situations, metronidazole acts as a trigger to accelerate nerve degeneration. Alarmingly, effects can become irreversible even if the antibiotic is stopped. That's why it should be used only for the strictly necessary time, under strict medical guidance. Besides neurological damage, metronidazole may also interfere with intestinal flora balance, compromising nutrient absorption important for nerve health. An unbalanced gut directly affects levels of vitamin B12 and folic acid, essential for proper nervous system function. In the long run, this imbalance may worsen medication effects on nerves. It's an indirect but powerful impact. Because metronidazole is a relatively common antibiotic, it's often considered harmless. But risks increase considerably with repeated or prolonged use. Patients using it for more than 2 weeks should be closely monitored, paying attention to any new sensory symptoms. Simple neurological and lab exams can detect damage early and allow treatment suspension in time. Number 2. Amiodarone. Amiodarone is a medication prescribed to control cardiac arrhythmias, especially severe and treatment-resistant ones. Although its effectiveness in controlling heart rhythm is well recognized, its use is linked to severe side effects in the nervous and vascular systems. Amiodarone toxicity affects multiple tissues, but peripheral nerves and muscles are among the most impacted. The result is intense neurological symptoms like tingling, loss of sensitivity, and progressive weakness. The problem is these symptoms are often confused with other conditions, delaying diagnosis. Amiodarone-induced neuropathy can impair basic functions like walking, holding objects, and even balance. Also, there's clear impact on peripheral circulation, harming tissue oxygenation. Cold hands and feet, cyanosis, and healing difficulties become frequent. The nervous system suffers not only from direct attack, but also from poor cellular nutrition caused by deficient circulation. Another critical point is amiodarane's long half-life. It stays in the body for weeks or even months after stopping treatment. This means side effects can persist or even worsen after medication discontinuation. This feature demands extreme caution in prescription, especially in elderly and those with neuropathy history. Drug accumulation in tissues worsens toxicity, especially in sensory nerves. Also, amiodarone can interfere with thyroid, liver, and lungs function, which in turn indirectly influence blood circulation efficiency and neurological health. It's a silent domino effect often unnoticed. Symptoms like excessive fatigue, shortness of breath, and mental confusion should be taken seriously. In many cases, they're wrongly attributed to aging when the medication is behind the problem. For patients who really need amiodarone, strict clinical follow-up with frequent liver, thyroid, and neurological function exams is ideal. Dose adjustments, plan breaks, and therapy replacements should always be considered. It's not about demonizing the drug, but understanding its real risks and respecting them. Ignoring them can lead to permanent sequelae and quality of life loss. Number 1. Statins. Statins, like simvastatin and atorvastatin, are among the most prescribed medicines worldwide, mainly to control cholesterol. However, despite their popularity, there's a dark side few know: statins' potential to cause neuromuscular and circulatory damage. They can interfere with nerve and muscle metabolism, causing often disabling symptoms. Muscle pain, which many describe as feeling like muscles are being crushed, is one of the most common effects. But beyond pain, the problem goes deeper. Statins can trigger or worsen peripheral neuropathy, affecting nerve electrical conduction. This happens because the drug reduces coenzyme Q10 production, an essential nutrient for cellular energy. Without it, nerves struggle to function properly, and muscles become more vulnerable to fatigue and atrophy. Patients feel numbness, tingling, and even loss of reflexes, especially in legs and feet. Another critical point is the impact on peripheral circulation. By interfering with muscle and nerve metabolism, statins also impair blood flow, especially in people with genetic predisposition or pre-existing diseases. Reduced vasodilation and loss of leg muscle strength make walking harder and increase fall risk. Blood stops circulating efficiently, and extremities become more prone to ischemia and lesions. It's a silent overload for vessels and nerves. Older adults are the most affected by these side effects. With natural aging of the nervous and circulatory systems, the body has less functional reserve. Continuous statin use can speed up neurological and vascular decline, often unnoticed by patients. Constant tiredness, muscle pain on slightest effort, and loss of sensitivity are clear signs something's wrong. Yet these symptoms are often ignored or treated as normal aging. Can these effects be reduced? Yes. Regular monitoring, supplements like coenzyme Q10, and dose adjustments make all the difference. It's also important to evaluate if statin use is really necessary or if other strategies like diet and exercise can replace it effectively. Each body reacts differently, and a medicine good for one may be harmful to another. Treatment personalization is the safest path. If you take statins and feel frequent muscle pain, numbness, weakness, or difficulty walking, don't ignore these signs. They may indicate your nerves and circulation are at risk. And now that you know the most harmful medicines in this regard, it's time to go further. In the next section, we'll talk about daily habits and behaviors that can worsen these effects and speed up neurological and vascular damage. Don't miss it. Habit 6. Not drinking enough water. Water is essential for the whole body to function, but its importance for circulation and the nervous system is often underestimated. When you don't drink enough water during the day, your blood becomes thicker, making it harder to flow through blood vessels. This overloads the heart and harms oxygen supply to peripheral nerves, which are extremely sensitive to poor circulation. The result is cramps, numbness, and constant fatigue. Dehydration also interferes with nerve impulse transmission because electrolyte balance, like sodium, potassium, and magnesium, depends directly on good hydration. With these imbalances, the body starts showing mild neurological failure signs that worsen over time. Sensations like needle pricks in the feet or difficulty concentrating can be early signs. All this can be avoided with something as simple as drinking more water. Also, lack of water reduces the body's ability to eliminate toxins, overloading kidneys and liver. When these organs don't work well, waste accumulates in the blood, further harming nerves and vessels. Over time, this inflammatory environment affects the whole circulatory system. What could be a natural protective action becomes a stress field for the most vulnerable tissues. Older people often feel less thirsty, but this doesn't mean the body needs less water. On the contrary, aging makes the body even more dependent on good hydration, especially to keep blood viscosity ideal. Without this, risk of thrombosis and cramp crises increases considerably. The nervous system reacts with slowness and loss of sensitivity. Don't wait to feel thirsty to drink water. Make it a habit to take small sips throughout the day and avoid replacing water with sodas or alcoholic drinks, which dehydrate even more. Keep a bottle nearby as a reminder. Proper hydration also improves absorption of nutrients vital for the nervous system. It's a simple measure, but with powerful effects. Habit 5. Sleeping poorly or irregularly. Poor sleep doesn't just affect your mood or energy the next day. Poor quality sleep has direct consequences on your nerves and blood vessels. During deep sleep, the body repairs tissues, regulates hormones, and reinforces nervous system integrity. When you sleep little or irregularly, this recovery is compromised and cortisol, the stress hormone, stays high. This increases inflammation and worsens nerve suffering. Also, lack of sleep harms melatonin production, a hormone with strong antioxidant and neuroprotective action. Without it, nerves become more vulnerable to oxidative stress, accelerating their degeneration. People who sleep poorly have higher risk of developing peripheral neuropathies, especially if already using nerve-affecting medications. Constant fatigue also reduces physical activity, further worsening circulation. Poor sleep also affects blood pressure and blood vessel health. Studies show people who sleep less than 6 hours a night have higher chance of hypertension and cardiovascular diseases. That's because the body, without proper rest, stays in constant alert. The heart beats faster, vessels contract, and blood flows with difficulty. It's a continuous and silent overload. Another worrying factor is irregular sleep's impact on glucose regulation. When we don't sleep well, insulin resistance increases and sugar is released uncontrollably in the blood, which can harm nerves even more. This is especially dangerous for those predisposed to diabetes or metabolic problems. Poor sleep creates fertile ground for chronic diseases. Sleeping well should be a priority. Set a routine, avoid screens before bed, keep a dark and quiet environment, and try to sleep at the same time daily. If possible, avoid stimulants at night like caffeine and sugar, as they disrupt the natural sleep cycle even more. Invest in relaxation rituals to prepare your body for sleep. Your nervous system will thank you. Habit 4. Excessive alcohol consumption. Excessive alcohol use is one of the most destructive habits for the peripheral nervous system and circulation. Although socially accepted, alcohol is a direct toxin to nerves, interfering with electrical impulse conduction and nerve fiber regeneration. The result is alcoholic neuropathy, characterized by numbness, tingling, muscle weakness, and loss of balance. These symptoms don't appear overnight, but build up silently. Alcohol also acts on blood vessels, causing unstable dilation, which harms blood pressure control and favors poor circulation. During drinking, vessels dilate too much, causing redness and warmth. But soon after, a rebound effect happens. Vessels contract strongly, reducing blood flow to extremities. Frequent use damages vessels and compromises tissue oxygenation. Frequent drinkers report symptoms like loss of leg strength, walking instability, strange skin sensations, and even memory difficulties. These are clear signs the nervous system is being attacked, often irreversibly. Even social, drinking can be problematic if constant and uncontrolled. When combined with medications, risks multiply. Habit 3. Smoking. Cigarettes are perhaps the biggest enemy of circulation and nerves. Nicotine, the main substance in tobacco, causes immediate contraction of blood vessels, making it harder for blood to reach body extremities. This leads to poor irrigation of peripheral nerves, which start suffering from lack of oxygen and nutrients. The result? Numbness, tingling, loss of strength, and over time, irreversible neuropathy. Besides nicotine, cigarettes contain dozens of toxic substances that directly affect blood vessel walls, making them stiffer, inflamed, and prone to clots. This further reduces blood flow to limbs, especially hands and feet. With less circulating blood, nerves suffer chronic distress and can even die. That's why smokers have higher risk of amputations, wounds that don't heal, and progressive loss of sensation. The good news is quitting smoking brings almost immediate benefits. Circulation starts improving in weeks, and nerve tissues get more oxygen and nutrients. In many cases, initial neuropathy symptoms can stabilize or even reverse. But the longer you smoke, the greater the risk of permanent damage. So the sooner, the better. For smokers already feeling numbness, limb pain, or poor healing, the alert is clear. Cigarettes are silently destroying your nerves and vessels. Seeking support to quit is one of the biggest acts of self-care anyone can do. Today, there are effective methods that help deal with addiction and minimize withdrawal symptoms. Your body deserves that chance. Habit 2. Diet rich in sugar, salt, and ultra-processed foods. Diet is one of the main tools for healing or destroying the human body. Unfortunately, most people today consume large amounts of sugar, salt, and ultra-processed foods, often without realizing it. These ingredients are highly inflammatory and, when consumed in excess, directly affect blood vessels and nerves. Sugar especially causes blood sugar spikes, leading to insulin resistance, a main factor for neuropathies. These sugar spikes damage vessels and worsen chronic inflammation, a silent process that weakens the circulatory system and speeds cell aging. Nerves' delicate structures end up receiving less blood and nutrients, losing response capacity. Over time, symptoms like numbness, cramps, pain, and tingling appear. In advanced cases, loss of sensory function can become permanent. Ultra-processed foods also contain a dangerous mix of bad fats, chemical additives, and colorants, causing severe metabolic imbalances. They raise blood pressure, deregulate cholesterol, and inflame vessels, making cardiovascular work harder. This combination silently destroys nerve integrity, creating a cycle of ongoing aggression often unnoticed until it's too late. The solution starts with eliminating or drastically reducing these foods from your routine. Replace sodas with water, sweets with fresh fruits, and ready-made products with homemade meals with natural ingredients. Adopt an anti-inflammatory diet rich in vegetables, good fats, and lean proteins. Your nervous system will thank you with more energy, less pain, and better sensitivity. Habit 1. Sitting or lying for too long. Lack of movement is one of the biggest silent enemies of circulatory and neurological health. Spending hours sitting or lying down every day drastically reduces blood flow, especially in legs and feet. This stagnation favors clot formation, worsens tissue oxygenation, and causes tingling, numbness, and swelling. Over time, nerves suffer from lack of stimulus and oxygen, becoming more fragile and prone to injuries. Sedentarism reduces blood vessel efficiency, making them less responsive and harder. This hinders venous return and worsens conditions like varicose veins, poor circulation, and fluid retention. And when nerves don't get enough blood, they start to fail. sensations decrease, reflexes slow down, and fall risk increases. All this happens without the person noticing, until the problem gets serious. Besides circulatory damage, inactivity also affects muscles, which lose strength and stop protecting nerves from impacts and tension. Muscle weakening contributes to postural changes that press nerves, causing pain and movement limitations. It's a domino effect. Nerve weakens, muscle atrophies, circulation drops, and overall health progressively collapses. You don't need intense exercise. Small breaks every hour make a huge difference. Standing up, stretching, walking for a few minutes, and moving your feet are simple actions that help activate circulation and preserve nerves. People who work long hours sitting can use phone or watch alerts to remind themselves to move. The key is not letting the body stay still too long. If you feel numbness in your legs, pain when walking, or a heavy feeling in your extremities, reassess your routine. Maybe your biggest enemy is the habit of staying still too long. And if you want to keep getting the best health videos, subscribe to the channel because it exists for one reason only: to make you a healthier person with better quality of life. Helping you is my mission. In the video now on your screen, I reveal the natural recipe with fruits that cleans your intestines in 12 hours. Click on the screen and check it out.